the NewsChannel 5 network. This is OpenLine.
And good evening, I'm Matthew Torres, and welcome to OpenLine tonight on NewsChannel 5+. All right, so we just finished our 30-minute special at 6:30 on the main channel that is Hooked, Tennessee's opioid crisis. But we wanted to continue the conversation regarding this ongoing problem that's really hitting our communities here in Tennessee. So again, we want to extend our conversation, and joining me to help with this topic are several people. With me to my left, we have Monty Burks, Director of Faith-Based Initiatives with the state. We also have Taryn Sloss, Assistant Commissioner, and we also have further to our left, Debbie Hillen, Senior VP with Buffalo Valley Inc., one of the organizations that we featured in tonight's special. So if anyone has any questions, any comments even, feel free to call the number on your screen, 615-737+. We'll be here for the next hour, so feel free to join this conversation. Guys, thank you so much for being here. When we talk about opioid crisis, I have come to learn, and I've covered many stories over the past few months, this topic just has so many layers. You can't condense it down to even 30 minutes. There are so many things, so many angles, so many different perspectives looking into this. For you guys, where do you see the opioid crisis now?
So right now, I'm really excited about what's going on. I'm really excited about the conversation that we're having. It's been so long that stigma around addiction has been, no one has been talking about it. So we're just really excited to have this conversation and have it out in the open where everyone wants to talk about it and find a solution to our problem.
Debbie.
Well, and I think the other part to that is the fact that our General Assembly this year has really taken a look at the stigma and reducing the stigma and putting an emphasis, what can we do together? And that's the first time in my 30+ years that I've seen the General Assembly step up to help us on the front line treat addiction.
And I like how you mentioned together, because the plan, the legislation is Tennessee together. What about for you, Monty?
Well, I work with the faith-based community, and this is really an opportune time and a wonderful time. Our faith community is really getting involved all the way across the state to provide buffers and safe places and places of haven for individuals that suffer from addiction. And all of that is part of the stigma being reduced across our communities. Stigma works more than one way. Not only are people scared to come out because they're scared of being judged, but our communities are also scared to help people because they're scared the community is going to judge them for helping others.
And that's why we wanted to make sure we start this special, the fact that anyone can be affected by opioid addiction, from mothers to teachers to any profession. There is no specific role. Do you find yourself, people are actually accepting nowadays the idea that opioid addiction is across the board?
Absolutely. We know that it touches every single community, every single demographic. It doesn't hold anybody back. And we at the department and with our treatment providers, our community-based providers, know that it's going to take a full frontal approach, as well as having more buffers in the community and more people like yourself that's willing to cover this, willing to put the stories out about what's successful and what kind of help we need.
For you guys.
One of the things, and it's a good news story, so I'm going to add it to it. This past week, one of our programs, Ari's Place, delivered a drug-free baby. And in the past, that mom would have been looked upon negatively. And now she can have a place to go for treatment, for housing, to deliver a drug-free baby and come back and live with that baby to learn those mothering skills. That's part of a stigma that's being removed for that specific population, but that just happened this week. And so we're real excited for the mom and the baby. They were discharged from the hospital Sunday.
And that's great news, and something that we never really got to touch upon in the special, babies with neonatal abstinence syndrome. This is a thing, but it's obviously also being tackled. I know we featured earlier this summer a mom who also was able to go through recovery herself through the Next Door in Nashville because of the treatment. And she says there is stigma, but she's hoping that, I guess, stories out there will actually help break this down. Do you guys see the opioid crisis going down? Do you see the problem lessening at all? or is that still too early to determine?
Well, I think it's still too early to determine. I do think it's still too early to determine. Over the last year, we have been working to educate the community on opioid use disorder. So because of that, we knew that the number of overdose deaths was going to increase because of the education around it. But what's so exciting about it is that people know that there is a pathway for them to recover from opioid use disorder.
Can you explain just, I guess, the scientific terms? You know, I've gone through surgery myself. I've been prescribed hydrocodone and certain painkillers, but I was able to let go of it once it's over. How can someone get so addicted that they want another bottle or another, fill? Can you explain that at all?
Well, I'm not a physician, so
yeah, we're not physicians
so
here.
we can't speak
I'm always
to that.
intrigued by that idea that obviously everyone reacts to something differently.
They do react differently, and I am a firm believer this is a disease model, and that there is some genetics that's involved there. And I was actually sharing with Monty a few moments ago with the fact that even raising my two daughters, I raised them to understand addiction, that they carried the genes to be chemically dependent and what that meant, and to make decisions based on that. Now, there's a lot that don't have that support as it goes through, and a lot of individuals will react to the trauma in their life. And if that support and that trauma, for that trauma is not there, unfortunately, they go down a path that may lead them the wrong direction. So I think with that, it's important that we realize that everyone reacts differently. You're right. You and I react in a positive way with the opiates they give for surgeries. Others do not, and there's a lot of factors. There's just not one factor, just like there's not one road to recovery. Right. There's also different paths in which someone does become addicted, and we have to be aware of that and to treat that person where they are with that.
Exactly.
Absolutely, and we have to understand as a community that we understand that people sometimes may burn bridges in their household. Sometimes things happen, relationships are broken, trust is broken. We have to understand this is still our child, this is someone's brother, this is someone's daughter. And instead of turning our back, this is the age of information. Let's reach out and find some type of resource, or at least somebody to come and talk to them. I'm a person that's in long-term recovery from substance abuse, addiction, depression, and lifestyle choices. I know that during my years of active use that I burned many bridges. I get that. I had a wonderful community that believed in me and supported me. They didn't endorse my lifestyle, but they endorsed me as a person. That was part of my process. I needed biological, psychological, social, and spiritual connections and structure to keep me in line where I could actually come and be a better person.
At what point, how long did it finally take for you something to click in your head and for your family, for you guys to connect and realize, all right, you need this road to recovery?
I'll tell you, man, about 3 years of active use, I hit rock bottom. I knew that I wanted to do better, but I couldn't, because what I'd done is, like so many people like me, I had surrounded myself by people who did what I did. People who wanted to do what I did at that time. So I built a community around myself that would be okay with me living that destructive lifestyle. But when I hit rock bottom, my family was there to embrace me, and they walked with me on my journey. Back then, we didn't really necessarily call it recovery support. They returned it all rehabilitation. But I was connected to a community that connected me to a 12-step, which eventually ended me up in a treatment program like what Miss Debbie Hillen runs. And through that connection, I was able to walk slowly, community connected, and find my recovery, find my journey, find my path. And actually, people like myself, we're called peers. We're able to go back into the community and share our story. We know that our story is not the only one. My path is one of millions of paths to get people to where they're going to get. Some people, they can stop. Some people, it's much deeper than that. But it's just one of the many opportunities that people have, is to go back and connect and share. That's what I needed.
Wow.
I needed people to stay with me.
And we've heard countless stories, just like you said, families destroyed, just burned bridges, and there are different ways, paths to treatment. I want to get now to the lines, because I know we have people waiting. I believe we have Renee. Hey, Renee, can you hear me? What's your question?
Yes.
Go ahead.
I'm here.
Go ahead, Renee.
The reason I'm calling is, matter of fact, I've been sitting here trying to call some rehab centers, and I had TV on while I'm doing this for my nephew. And I saw it on the news on Channel 5 where they were having the opioid crisis, reporting it. And I thought I'd call to see if I can get additional advice. Unfortunately, I've called the Red Line, and they gave me some recommendations and texted to me, and then they hooked me into a place called Samaritan Recovery, but recovery will not take someone that needs to detox. It's my nephew. I'm calling for him, and he needs a detox. He's using opioids, and he's not doing very well, and he doesn't have insurance. And I'm not sure which direction to take. He doesn't know what to do, and he's pretty desperate.
Okay.
What can we do? I mean, he's ready to go, and we don't know what to do.
Thank you for that call, Renee. Appreciate it.
Okay, that one I can answer. Buffalo Valley, through a grant with the state, in addition to insurances, has a medical detox program here in Nashville. And through the state funding, it is for those who have no other resources. And so if she would just reach out and call 615-262-2237.
Can you say that again?
615-262-2237. And if she'll get me time to get off air with you, then I will make the call and give her name and ask them to help her when she makes that call.
Do you get that call often? It seems like, all right, I got this particular place doesn't accept my insurance. I don't know what to do. It seems like that's almost they're in desperate mode. It
is. And at the detox, we see a lot of them in the desperate mode. I took a call last night from Skyline ED. It wasn't an overdose, but someone came in and says, I need help. And they picked up the phone, and they happened to have my cell, and they called me, and we got that person straight on into detox.
Perfect. I want to go now to, I think we have Colin. Hey, Colin, thanks for calling. What's your question?
Yeah, I just wanted to call in and bring attention to the chronic pain patients that are being kind of left in the wake of this, not getting treatment or adequate enough treatment. And, just say that many of us aren't addicted, but, maybe dependent, but, I think that's completely separate, or not quite the same, anyway.
All right, thank you for that phone. I wasn't able to understand clearly. Did you guys able to hear?
The only thing that I understood, and I'm not being a doctor, I don't feel comfortable, but what I understood the question to be was, what about those on chronic pain? And with the restrictions that have been put on the opiate prescriptions, what about those who are actually suffering from chronic pain? What are we still doing for those individuals?
Which we have heard, and that was also part of our special. There are concerns from chronic pain patients as far as the access to opioids that they have been so used to, if limiting the prescriptions or even the access. What will happen to them? Someone even mentioned the fear of suicide, even because the pain is just so excruciating. Can you guys talk about that at all? Any knowledge on that?
I think, and again, not being medical and would not even begin to touch the subject, but I think the appropriate place is to contact the Department of Health, the chronic pain division, and get some information from them.
Yeah, it's a very vocal community. I know even prior to our special airing, they wanted to get their thoughts out there, and hopefully we were able to do that tonight. Hey, Gloria, thanks for calling. What's your question?
I have a son. He's 31 years old, and he is on parole. They were going to send him to Buffalo Valley, but the driver said that he could drive to the detox place himself, which he never went. He's not going to go willingly. Okay, he just got out of the hospital. He was yellow because his liver, because he's doing crystal ice, cocaine, and heroin, and he's shooting it up. And I haven't heard from him in almost 4 days now. He won't answer his phone. He's somewhere on Shelby Street. What do I need to do?
All right, Gloria, thank you for that call, and I'm so sorry what you're going through. What can you say to Gloria at this point? It seems like he was supposed to go and then never made it.
You know, obviously we run into situations where individuals may not necessarily want to go to programs that we as parents and people who love them want to find whatever way we can get them to go to a program, and sometimes there's a disconnect there. And what I would say to Gloria is to reach out to one of the peers in the community, reach out to one of the programs and connect with someone that's in the program that has a peer capacity, and maybe when she gets back in touch with her son, if she can, to let that peer talk to her son. The peers are trained on how to give guidance and to let individuals know about the appropriate resources and how they can be beneficial to them, and kind of let the individual build that process themselves, which empowers the individual to actually go to the programs.
But it seems like she's just now waiting to hear back from her son, and it seems like a waiting game.
And as a family member, that's a terrifying position to be in, not knowing and just waiting for that next phone call. And we just encourage her to keep reaching out. Once she hears, again, I would say to use the same number I gave out earlier, and we will do our best to try to get them there, but it's up to them as to whether or not they come.
And that number is 615-262-2237.
Correct.
So, and if anyone else has questions or comments, I know we have people waiting in line. We'll be back with more of our special edition of Open Line.